My name is Renata Twini, a journalist with Solutions Now Africa. I'm documenting a series of responses to Uganda's healthcare access challenge. Today, I'm looking at this telemedicine, the use of mobile digital technology to offer remote Medicare services. This is Sharif Tibita. He is a laboratory technologist. Tibita is part of a group of young health professionals pioneering telehealth as a response to the country's health access challenge.
For the day, I can serve 10 or more than that, because you find some families have 2 to 3 people. Sometimes you're working on a group. The patient, mostly they provide with the location. Those people on the dispatch, they call the client, they confirm where they are. This client was contacted before I was given the order. So I call him back, just confirm exactly where he is in Mukono.
Telemedicine gained popularity in Uganda during the COVID-19 pandemic, and it was accelerated by private players like Rocket Health, where Tibita works.
Our solution was to make healthcare a lot more accessible for people, and that could be through the mobile phone. You can have a phone call with a doctor, you can have an SMS conversation or a WhatsApp chat, and then if you are having trouble accessing some medical facilities or even medical products, we can be able to source those for you and have them delivered to your location. Even when it comes to lab tests, we make sure that we do those at your convenience and then also in your very convenient location.
A client satisfaction survey of the national health sector says Ugandans on average spend 4 to 5 hours in public hospitals before they receive Medicare services. This is time spent in navigating sections like the accounting desk, the doctor's office, the laboratory, and the pharmacy. According to a 2021 survey by research firm Afrobarometer, 74% of Ugandans go without medical care every year. This is because of systemic challenges in the health sector. A study by UNICEF indicated that Uganda's average universal health coverage stands at 59%. This means that about 41% still find challenges in accessing health care.
So the congestion we see it more at the general hospitals in the districts and the regional referral hospitals. The patients tend to really go to the higher centers where they think there is enough manpower. You are staying near a regional referral hospital, you have malaria, you just walk in. The bigger centers are responsible for handling complicated cases.
Amidst these challenges, experts, both in private and public sector, are looking at disruption from mobile digital technology as a crucial intervention.
We've tried it for antenatal care for women, monitoring, most especially where we think that the opportunity cost for coming to hospital is very high. Under Vision 2040 calls on all sectors to adopt technology as a way to optimize service delivery. The current national health policy, for the first time, adoption of digital technologies to optimize service delivery is articulated very clearly.
In telehealth, doctors are the first point of patient contact. Patients make remote consultations through phone calls or teleconferencing. This costs 10,000 Ugandan shillings, about $2.65.
When you call in, I'll give you a real-time consult. It's like you're in the hospital looking, as in you're speaking to each other. But in this case, we're on phone, okay? So you mention the symptoms you have. I'll have to ask a couple of questions, get to see what symptoms are you presenting with. Do I really need to do labs, or can I just manage you off with what? Medications.
To test the authenticity of telehealth, I made a request for the service at my office.
Hello. Yes, good morning. I want a malaria test.
My call was received at 2:15 p.m. I have received the medication at exactly 3 p.m. That was quick compared to the medication that we always get from public hospitals.
I think the flexibility that you can access a doctor online and they prescribe medication and then deliver medication to you, I think is the best reason as to why this becomes an option.
At the client's place, we always ensure that we clearly label all our samples, and then we package them in a way that they'll be safely transported back to the lab. So we want to avoid things like leaking, things like contamination. Then we also track the time from when samples are taken to when they are brought back to the lab.
However, there are still gaps in the implementation of telehealth in Uganda. Players like Rocket Health, for example, have to train staff to fit in the system.
The education system doesn't train them for our kind of service. They go through a very intense training period where we have to, have this culture introduced to them, the telemedicine culture, and also basically our way of operation.
You're actually trained to see a client physically, not with telemedicine. Okay, you should be able to actually imagine things, okay? Because someone will describe to you what they are feeling, or maybe describe something to you, and you should be able to run it through your mind very fast. You have to be at 100 at all times. And someone tells you, I have this and this and this and this, so you start thinking, what could this be? Which compared to when you see a patient physically, you're able to tell this person looks very sick. But now you're using the voice of the client to judge the tone of their voice, the speed of the way they're talking, okay? And see if this person is actually very sick and he can't manage on phone, or is someone I can actually manage on phone as well. So you actually have to be very, very attentive.
Another barrier is the bureaucratic red tape, which has caused delays in developing telehealth framework, contrary to the World Health Organization recommendation.
The Ministry of Health has been developing a national guideline for implementation of telemedicine in Uganda. And even colleagues from Rocket Health were consulted. It is just that the document hasn't gone through formal approval, but it is really in the final stages of development. So the guidelines are there, they're in draft, they're not yet finalized, but very soon we'll be going through formal approval processes and have them freely available for everyone who wants to do remote care to know what the do's are and what the don'ts are.
As the government struggles to create a solid telehealth structure, the private sector has moved quickly to answer the call.
In the day shift, we have 6 to 10 doctors, depending on the traffic. And then on the night shift, we have 2 to 3 doctors, also depending on the traffic. So we want to ensure that there is a doctor at every point in time. We have served over 70,000 Ugandans.
In June 2021, when Uganda registered a spike in COVID-19 cases, Rocket Health registered over 75,000 cases in just 1 month. Since then, clients have never looked back at telehealth. It operates a 40-kilometer radius model, where one clinic with a laboratory and a pharmacy are able to serve thousands of people in the radius with time and efficiency.
Through telemedicine, we have one aspect or one way of making the service available, for example, through a call center. Now, a call center is something that can be used by even the remotest person. You could say in a place like Kalangala, in a place like Gulu, in a place like Kapchora, people can use such services through a call center. So you'd imagine if the government could help like these kinds of things be scaled and available, one, emergencies could be responded to better, even from the remote settings, and at the end of the day, you'd find healthcare is better.